Hey everybody, welcome to Options Rehab. Dr. Ruiz here. This is Dr. Nick, our physical therapist. And I've had a lot of friends, patients that have asked me, what is it that you do to treat shoulders? Whether it's a tear, whether it's bursitis of the shoulder. There's a couple different things that we do. Specifically, I deal with a lot of jiu-jitsu artists and a lot of wrestlers. My son's a wrestler. So I get asked this question all the time. So one of the things I wanted to do today is to do a video to demonstrate what it is we do here at Options Rehab on rehabbing shoulders, specifically with a couple different treatment protocols that we do here, and then some that you could do at home yourself. So the first thing is Dr. Nick here actually has injured his shoulder. What was it, weightlifting?
Yeah, a couple of days ago, just working out at the gym. Working out
at the gym. So the first thing we do here is we do a little bit of a treatment called ART, and ART is active release therapy. And basically what I want to do is just get in here and release some of the tissue that's in the shoulder girdle. Rotator cuff muscles, the sits muscles, external rotators, so on and so forth. So the first one we'll do is, where exactly does it hurt?
Right, insertion of supraspinatus,
okay.
Subacromial.
So right on the outside. All right. So the first one we'll do is we're going to loosen up the whole shoulder girdle and reset everything. This is a little uncomfortable, but we go in here into the armpit and you get your subscapularis area. Okay, and just relax. And what happens is if the whole shoulder isn't functioning right, then the whole mechanics of everything goes to creating a biomechanical issue in the shoulder itself. Then we go right into the axle itself. You okay?
Mm-hmm.
Okay. Pec muscles. Now we go ahead and use a tool that we call FAKTR. It's actually a technique. It's instrument-assisted treatments that we do here. And it's actually really nice because it allows me to dig in deep without having to use my fingers as much. So the first thing we do is put this cream here, or emollient, and what it does is it allows us to glide on the tissue surface. Now these marks you see on him is from cupping. We also do cupping here. What we call it polka dots, right?
And also what the beauty of these techniques are, the more acute, the more fresh the injury, the quicker it heals. So it's imperative day one of injury. So I did a little cupping myself at home for some self-treatment, and the FAKTR technique is a scraping massage that works concurrently with cupping. So combining the two separate modalities that have both been around a very long time, we've been getting some incredible fast results in the PT and chiropractic department.
All right. So Nick, what motion, so we asked the patient now, what is the provocative motion movement that makes the injury worse? So what particular one do you feel it mostly?
Lately it's just been with most movements, but especially like reaching overhead, like once I get to 90 and above, it seems to kind of pinch a little bit. So the sensation or pain I'm feeling is kind of, I guess, right around a little bit. If I had to pinpoint, it's right in there.
All right, so what we'll do is go ahead and just hold on to the strap. And just to make this for demonstration purposes, I'm just going to seal leg strap, so I'll just step in it.
Mm-hmm. So the beauty of the technique also is doing the treatment while we're provoking the symptoms.
All right, let's go ahead. Is it give me an overhead press?
Yeah.
So I'm going to treat him while we're activating the muscle concentrically, but the most important part is actually the eccentric contraction, which is on the way down. It's where you build most collagen in the regeneration process here. Give me a couple rep out on that. And usually we'll ask the patient, do you have any pain? By the time we're done with this, they feel no pain. And then we'll move on to our rehab series after this. Good?
Yep.
Try that, see how it feels.
I feel a little bit more clear. I would say like 30% less pinching or symptoms there, but still a little bit in range.
Good
but
deal.
definitely better.
And obviously for the purpose of this video, we're just doing a shortened version of our treatment. All right, so just tune back with us. We're gonna go ahead and show you the proprioceptive input TheraBand exercise protocols that we use for our shoulder rehab. Give us a like and a follow.